Words cannot express how honored and thrilled we are this morning to host Health and Human Services Secretary Kathleen Sebelius. I am one of those people who remembers where they were on Sunday, March 21st, 2010, when the House of Representatives passed the Affordable Care Act and enabled President Obama 2 days later to sign that into law. We knew history was being made at the time. And at that time, the promise of affordable insurance enrollment for all Americans and the January 1st, 2014 date seemed so far away and a very distant dream. Yet here we are today with so many enrolled and so many enrolling every day. And I think of my fair lady and Alfred P. Doolittle, just a few more hours. That's all the time we've got. And I think it's about 108, maybe 110 right now. Our four enrollment staff are only a small part of the force in Nashville and Tennessee that have worked tirelessly to assist as many as possible. In a few short months, our four have touched personally over 2,500 people and over 500 we know actually enrolled. But the message today is not what we have done. It is that we and all our colleagues have the staff and the infrastructure to enroll many more in the remaining days and the 108 hours until the March 31st deadline. Allow me now to introduce our Mayor, Carl Dean. We all know Mayor Dean as the health mayor. When we think of Mayor Dean, we think of greenways. We think of those pictures of him starting off those Saturday walks, and we see the new bike program and the impact that has had. But most do not know the commitment Mayor Dean has made to the care for the underserved and the uninsured, whether it is the support of health care of the homeless or the support for specialty and inpatient care for the uninsured residents of Davidson County. Mayor Dean has been there. No wonder then that Mayor Dean has shown the passion he has for promoting the affordable health care through the insurance exchange. Please give a warm welcome to Mayor Carl Dean.
Well, thank you, Mary, for that introduction. And I, too, want to welcome U.S. Health and Human Services Secretary Kathleen Sebelius to Nashville. I'm so proud that you chose Nashville to bring attention to the fact that the deadline to get insurance through the Affordable Care Act is approaching fast. Last fall, at the request of President Barack Obama's administration, I pulled together a group of people. They came from metro departments. They came from health clinics like this one. Mary, I think you were with us that day. They came from nonprofits and even from congregations. I asked for help, some serious help. At that time, we had about 105,000 uninsured Nashvillians. Some of them were young people just starting out in the workforce with jobs that do not offer health insurance. Some of them were self-employed or small business owners. Some of them with pre-existing conditions that disqualified them from being able to buy insurance, even if they could afford it. Some just moms and dads trying to make it, working 2 to 3 part-time jobs, but no access to health insurance. This insurance plan came at a time when we were really working hard to move the dial on health rankings here in Tennessee. They are not all that good, and my administration is trying to change that. Our focus is encouraging healthy eating and active living and giving people in all parts of Nashville access to resources to help them make healthier choices. Greenways, community centers, sidewalks in their neighborhoods, and more bike lanes. But there's a whole other piece to healthy living, and that is access to affordable care. It's the ability to see a doctor when symptoms first occur. It is good preventative care. I knew the Affordable Care Act could be a game changer for so many people, but they had to know about it, and some of them, to be honest, would need some help in signing up. Secretary Sebelius, I want you to know that this work that I invited, this group I invited to meet with me went to work right away. They sponsored training sessions, they made public appearances, some of them even went door to door, and they staged events. In October, our Affordable Care Act consortium coordinated about 75 events. Now they average 200 events a month. They are still working 7 days a week, late into the night, and they will be busy up until and through March 31st. Many of them are volunteers. In fact, the majority of them are volunteers. I want to take just a moment to offer them a great thank you on behalf of myself and the city of Nashville, and on behalf of thousands of Nashvillians who now have insurance because of their hard work. I would not dare leave the podium without saying this. There are some people out there who need this insurance. You have made it up in your mind to enroll, and now you have to find the time to actually do it. Well, let me encourage you, and I actually implore you, make that time. No, it is not too late. If you have not signed up, you can still do so. And if you have signed up and don't have a card, double check to make sure you are enrolled. Our volunteers will help you. For the next several days, volunteers will be in metro libraries. They will be at health clinics throughout the city. I know they will be at a location near you. Just go to www.getcovered10.org to find an event or a registration location near you. Thank you for this opportunity to speak, and once again, thank you to the Secretary for coming to Nashville. It's my distinct honor to invite to the podium the 21st Secretary of the U.S. Department of Health and Human Services, the woman who has directly overseen the implementation of the Affordable Care Act for President Obama, Kathleen Sebelius.
Thank you, sir.
Thank you.
Well, good morning, everybody. I'm delighted to not only be at one of our great community health centers, the United Neighborhood Healthcare Services. As Mary knows, I'm a big fan of the work that community health centers do each and every day to improve the lives of millions of Americans. I want to thank Mayor Dean, who has been a great partner. You know, what we found is that mayors are pragmatic CEOs. They understand what the impact is of having a healthy workforce, a healthy student body, healthy communities, and it not only adds to the quality of life, but it clearly adds to the economic vitality of a community. So Mayor Dean has opened up libraries and had the health department take a leadership role in outreach and education, and I want to thank him for that ongoing effort. I'm here in Nashville because we are approaching a deadline, and in Tennessee, about 16% of the residents of this state started out uninsured but eligible for affordable health care, and about 194,000 of those folks are right here in Nashville. As the mayor said, there are days left to sign up, including today. We've got really 5 days left. And what we're seeing is unprecedented interest in the opportunities that people finally have for health security and financial security. Yesterday alone, we had about 1.5 million visitors on the website, healthcare.gov. There were no issues, no glitches. People were able to find information that they needed, and we had almost 500,000 calls to the call center. That's just the federal website and the call center that is for the federal marketplace for about 36 states, and we're seeing similar activity in states running their own marketplaces. So the website is probably the fastest and easiest way for those in Tennessee who still have questions or issues to get your questions answered and sign up at healthcare.gov, or for Spanish speakers, it's cuidadodesalud.gov. Both are up and running smoothly, and running 24 hours a day, 7 days a week. There's a second way to sign up easily, which is calling the toll-free call-in number at 1-800-318-2596. Callers are available 24 hours a day, 7 days a week, in English, in Spanish, and then translation in up to 150 languages. People can actually get information about what's available in terms of health plans here in Nashville or in areas around Tennessee, get their questions answered, and then actually go ahead and enroll on the phone. Or, as the mayor and Mary have indicated, there are wonderful navigators, assisters, volunteers throughout this city. Every community health center has outreach and enrollment individuals. There are people at the libraries throughout Nashville. There are a variety of events where people can come and get help. If they don't have a computer at home, There'll be computers there with people who can help folks sign up. And what we know is that this insurance is very affordable. So if you're a 27-year-old here in Nashville trying to make your break singing at the Bluebird and trying to break it into the music scene, and you make about $25,000 a year, you can get covered for as little as $104 a month. Now, you probably can't find a cell phone plan for $104 a month. You may not be able to find a cable package for $104 a month, but you could get full health security. Finally, I just want to mention that there are about 520,000 people across the state, 103,000 here in Nashville, who would qualify for expanded Medicaid if the governor and the legislature move forward on that piece of the Affordable Care Act. The federal government would pay 100% of those costs for the first 3 years and gradually reduce the federal share, but never less than 90% federal, 10% state for the rest of the 10-year period of time. Each and every day that Tennessee doesn't sign up, not only do a lot of people find themselves still without that affordable care option, the lowest income working adults, but Tennessee is losing about $6.2 million a day in federal funding that could come into the state to pay 100% of the costs of the newly insured. And I know, Mr. Mayor, that would sound pretty good to you, because my guess is taxpayers are picking up a lot of those costs today while people come through the doors of an emergency room and have no ability to pay their bills. Somebody else, taxpayers, hospitals are bearing the cost of those bills. So healthcare.gov working well, toll-free hotline, help on the ground. It could not be easier, but March 31st is the deadline, and we want to encourage people to take advantage of what is an historic option. It's now my pleasure to bring forward a local Nashville resident, Amy Spees, who's been a consumer in the system and has her own story to tell. So, Amy, if you'd join us at the podium.
Secretary. Absolutely. Thank you very much. Hi, my name is Amy Spees, and I am an independent singer-songwriter. I'm a professional musician who works under the radar of the major label system. There are a lot of us. There are thousands of us here in Nashville. I have been an artisan or an artist since I graduated college, and I spent most of my 20s and 30s uninsured because I couldn't afford health care, which meant that anytime I had any kind of physical emergency, any health emergency, I was a burden to the emergency room system. I didn't like that. I didn't have any other options. I am in my 40s now. I make a middle-class living. I consider myself a very small business owner. And I have been able to afford to have health insurance for the past few years through a group plan that came through various music organizations. However, my monthly premium was extremely expensive, and the only way that I could even afford that premium was to carry a very high deductible. And that worked for me for a few years until about 2.5 years ago, I lost my voice suddenly. I had acute laryngitis, which doesn't sound like a really bad health scare unless you're a singer. And when you are a singer and you get laryngitis, you cannot sing, you can't work, and if I can't work, I obviously can't pay my bills. Luckily, I live in Nashville, Tennessee, where the best, I think, voice clinic in the world exists at the Bill Wilkerson Center for Otolaryngology at Vanderbilt. However, most of my costs associated with getting my voice back came under my $5,000 deductible. And as a very small business owner, as a working journeywoman musician, I do not have $5,000 sitting around. I do make a decent living, but I live month to month, and that is the reality for many musicians that, in fact, more musicians than you know who are famous. The side people, the guitar players, the piano players, the folk musicians, the Americana musicians. So it threatened me into bankruptcy, to be perfectly candid, and the only option I had was to look to charity to help me not only pay my medical expenses, but my living expenses. I am truly blessed for the services of Music Cares here in Nashville, a division of the Grammy organization. So all that said, I have definitely suffered by not having affordable health care. When I first heard about the plan, I didn't think that the Affordable Health Care Act would be for me because I did have insurance. And it took speaking to some of my friends and doing some research and spending time on the website to find out that not only was it for me, it was a better plan for me. I did spend an entire day on the website back in, I think, November, and it was slightly frustrating, but I have to say the frustration was taken completely away when I found out that the plan available to me as a 46-year-old woman, single, no children, was a Blue Cross Blue Shield plan, the E-plan. I am covered at a $500 deductible. I was able to use my student loan my student loan interest payment, which, yes, I still pay, as a tax credit to offset my premium costs. And so my premium, my monthly premium, I am unbelievably baffled to say, is under $30 a month. Now, for somebody who lives month to month, to be able to have a health care plan that my yearly outpayment will be $500. Everything else is 100% covered if I stay in network. I will have $500 sitting in my bank account, not $5,000. So to know that helps me with my health care because as a singer, the last thing I want is stress. Stress will take away my health, will take away my income. So I am completely blessed and grateful to this system that has become available to all of us. And I have been on the phone with every musician I know for the past month, shouting from the mountaintops for them to spend the time. I did spend time on the website, and I did call the 800 number, and I was able to get through to somebody who could walk me through the plan and talk to me about what was available to me. I'm grateful to be here with the mayor and the secretary to tell my story. Thank you so much.